In this lesson, we're going to cover urinary elimination. There is a ton of info, so get ready. We're going to hit on a lot of topics today, but there are a couple things I really want to hit on right before we get started. And there are two really important parts that we need to focus on, which are dignity and safety. Using the restroom can be really, really awkward for the patient, and you need to make sure that you're providing them with plenty of privacy. The other thing you want to focus on is safety. And when I'm talking about safety, I'm talking about reducing or eliminating the risk of infection. You can really, really work on this by using good judgment, making sure you're providing good catheter care, and making sure that when you insert any catheters or you're dealing with any devices, that you practice sterility. You also want to remember that you're in charge of your patient's urine output. And also the device they're using. Make sure that you're always checking you're measuring your patient's urine output. You want to make sure that you're making sure that there are, if there's anything that's concerning, you need to address those concerns with the provider. Don't wait to call them. If you see that there's a decrease in urine output, or the urine smells, there's a particular odor to it, or there's a particular change in like its clarity, or any one of these things that you think should be noted to them, then go ahead and do it. Don't wait to call them, because when you delay, we could make a complicated situation even worse. But as you go further into your nursing career, you're going to use all of these devices. So make sure that you familiarize yourself with them now. When we're dealing with external aids, these are things that are on the outside of the patient. So the two most common ones that you are going to see are probably urinals and bedpans. There's a male urinal and a female urinal. I have never seen this in real life, but it doesn't mean it doesn't exist. But if you do run across one and you have a female patient that really wants to use it, by all means, let them have at it. The most common one that you're going to use for patients is going to be more along the lines of a bedpan. Bedpans are great. But just make sure that you're using them appropriately. If you have a patient that has like an orthopedic injury or pelvic injury, they won't be able to sit on these bedpans because they're either uncomfortable or put too much pressure on them. So use something like a fracture bedpan for those patients. If your patient can get up, bedside toilets are great. If they can ambulate, if they're safe, if they have good bearings, make sure that you're providing, a safe environment where it's set up. Make sure that they're not going to trip anything. But if they're connected to like tubes or lines or monitors, these are great because you can put it right at the bedside. They can get up. They have more independence, more autonomy. It's you're providing them that privacy and the dignity. These things are great. One other one that you may run into is this guy, the condom catheter. It literally is a condom attached to a tube and a drainage bag. These are great for urinary incontinence. And what happens is some patients don't know that they're actually going. So you hook it up and it just goes into the bag. But a couple of notes, they do leak a lot. They will slip off. So make sure that you go in and anytime you interact with your patient, just say, hey, can I take a peek? I want to make sure that that thing is still on and doing what it needs to do. That way you're not getting any skin breakdown, because sure enough, these things will leak. They'll slip off. They'll continue to void on themselves. And then you'll get skin breakdown from all that irritation from the urine. So make sure that you're cleaning your patient up and you're staying on top of it, because the last thing you want to do is get any of that irritation from the urine. When we talk about internal devices, we're literally talking about placing a tube inside the patient, but not surgically. And the most common type that you're going to see is the Foley catheter, literally a tube with a balloon. It's got a port, and this part is usually hooked up to a drainage bag. The other one that you may run into is the in and out catheter. This goes in the patient, drains the bladder, and then you take it out of the patient. With these two, you still want to practice your sterile technique when you insert them, because the bladder, inside of the bladder, is a sterile environment. But there are a couple points that I want to make with these two things. First is that because this thing, this balloon is filled with saline, and you insert it into the patient's bladder and you fill it up, and it keeps it from sliding out. But what you don't want to do is, when you have to remove it, just to pull this guy out, because you're going to cause damage to this urethra and you can make a bad problem worse. So whenever you insert it, make sure it's completely deflated. Whenever you when you take it out, make sure it's totally deflated, because you really don't want to cause any damage. The other thing that you really want to focus on when I talk about sterility here is you want to reduce or eliminate the possibility of your patients getting it's called a catheter-associated urinary tract infection. And what happens is a lot of nurses, and it happens, they're not practicing good pericare. They're not taking care of their catheters. They're not keeping their patients clean. And when you do, you actually increase the possibility of an infection. So what you want to do is you want to be diligent, do your pericare once to twice a day, or whatever your unit says. But just make sure that you're practicing good pericare, good cleanliness with your patient, good hygiene. That'll reduce this opportunity for infection. Sometimes our patients need surgical help in order to urinate, and that's totally okay. And this list here is not all encompassing, but what I do want you to know is that these are kind of the most common types that you're going to see. But we're going to start with the first one. It's called the suprapubic catheter. And what it is this is the abdominal wall. Usually there's a problem down here in the urethra. And what happens is the patient can't void. There's some sort of urine can't go down. So what happens is if this is the abdomen, they'll insert a tube into the bladder with a drainage bag out here. And what happens is as the bladder gets full with urine, it drains into this bag. These things can leak commonly kind of right at the skin. So make sure that you're paying attention to this. But there's damage, and what we're doing is whenever we're looking at all these different types of tubes, we're looking at where the damage is. So the damage here is below the level of the bladder, so down here. But these things are great for patients that have, urethral trauma. The next one we're going to look at, let's erase this stuff. The next one we're going to look at is the nephrostomy tube. So if we go back to anatomy and physiology, these are your ureters. If there is a problem with the ureters, or a ureter or ureters, what will happen is the surgeon will come in and place a tube directly into the bladder. And you've got your drainage bag. This is your nephrostomy tube. So you have damage below the level of the kidney. They're usually going to be inserted to through the back or on the flank. What you need to remember here is that just because this ureter doesn't work, doesn't mean that this one isn't. This one could be good to go. So they're still going to produce urine in here and still void this way. So what you need to do is we're going to measure this output, and we're also going to measure this output, because both of those are important. The last one is the ileoconduit. What the ileoconduit is if there is a problem where a patient has to have like a complete bladder removal and they can't void, well, we have to figure out, the kidneys are still good. What we have to do is we have to redirect these. So if this is ileum, what will happen is the surgeon will come in and redirect their ureters. A lot of times they'll actually put like tubes directly in the kidneys, but they redirect it. They're just redirecting plumbing, and they redirect it to the ileum, and then they'll create a stoma out here, and you've got a bag. You've got your it looks like a colostomy bag or an ileostomy bag, but it's a pouch, and urine comes in and drains into here. What you need to do is recognize a couple of things. Number one, they're probably not going to void this way. And the other thing is you want to measure this output here, and you also want to provide stoma care. And you're also going to start talking to your patient about taking care of their stoma and their ostomy bag. There's a really good, there's some really good information in the bowel elimination lesson on stoma care, so go check that out. But the thing that you need to remember is that this focuses on bladder removal, and we're redirecting the urine output to this bag. Today, for our urinary elimination lesson, we really focus on elimination of functional ability for our patients, and also safety by reducing the risk of infection. Okay, so let's recap. Your patient may not always be able to eliminate on their own, so make sure that they're using the right device, and always focus on doing pericare and catheter care, because we want to make sure that we're reducing the opportunity and risk for infection. When you have the opportunity, use external devices for your patient. You've got your urinals, you've got your bedpans, you've got your bedside toilets. You want to aim for independence and autonomy for your patients. If your patients have an internal device, only use them when you have to, and remove them as soon as possible. We want to reduce the opportunity for infection. Surgical interventions are usually a last resort, but you need to know what device they have so that it kind of gives you better insight as to what's going on with your patient, and also to know what you should be looking for in terms of measuring an output and concerns. Also, speaking of concerns, call your provider. If there is a change that is concerning, or there's a problem with your device, or there's some sort of concern with the urine, call your provider. Don't delay in doing it, because you could have some real complications if we wait. That's it for our lesson on urinary elimination. Make sure you check out all the resources attached to this lesson. Now go out and be your best selves today, and as always, happy nursing.